I'm here to talk about Vivistim. It's a device for neurorestoration for chronic stroke patients. I'm going to start by telling a story about Joe, and if you can bear with me, I think it is really indicative of what the whole story is about.
I'm Joe. I'm a guitar player. I work on classic cars. I remodel houses, and I had a stroke 5 years ago. My whole right side was dead. I couldn't really use it for anything. My guitar playing was terrible. It was a death of my body. I just had to figure how to get it back up and moving again. With playing my guitar, the interventional therapy didn't help me that much. It wasn't until I started Vivistim that I could get to where I could hold a pick properly, finger pick. I made huge leaps and bounds within weeks, and I could get a lot of my movement back. And my grip is really what's improved. My grip was at probably 2 or 3 pounds, and they brought me up to 95 pounds on my right hand, which is a pretty amazing amount of strength in the grip. After Vivistim, I'm able to use my tools again. I can work on my cars. I can use a cordless drill instead of screw in the drywall. I could turn my socket wrenches easily. I could get behind the dashboard of a car I was working on and use my right arm to tighten all the little screws, then the little wrenches back there. And before that, I couldn't do any of that. Before Vivistim, I felt like a burden to my family. After Vivistim, I could feel a lot better about myself. I just worked so hard, and every day was improvement. I want to get up in the morning because I'm ready to go out and do things. And they're so much easier to do now. Before, everything was a burden. Today is the day I can work on my car. Today is the day I can work in my yard. Today is the day I can play my guitar with confidence. What I would tell another stroke survivor is just have to have the energy and the will to want to go through with it to make it work out for you in your life. Today's the day to get on Vivistim, make your life much better. I recommend this to anybody.
So it's important to always start with the good news. This is what happens after Vivistim. But let's talk about the problem. Chronic stroke survivors have few treatment options. After you recover from a stroke, you go through inpatient rehab, outpatient rehab, and then you're basically left with learning how to deal with your impairment. You lose your independence, you aren't able to go to the bathroom, dress yourself, drive. And this impacts 60% of the patients that recover from stroke and go through rehab. When we talk about chronic stroke, it's a new definition. What we're really talking about is this 3 to 6 month period post-stroke. We don't talk about the area before because you can go through spontaneous recovery. We really want to capture patients when we know that an implant is appropriate for them. We also know that when patients go beyond 6 months, their upper limb impairments impact their quality of life, and they also worsen over time. So who is this patient, and are they interested? So the most important thing is chronic stroke patients self-identify. They know they had a stroke. Their upper limb doesn't work. And also, they have all of these people around them that are telling them to have this problem. Our market research shows that 80% of people are looking for a solution today. So what is the solution? FDA-approved Vivistim is a paired VNS system. It is an IPG that goes into the chest with a vagus nerve lead. It's controlled by a laptop with software and a wireless transmitter. The therapist stimulates the device while the patient is in therapy. And pairing VNS with rehab induces neuroplasticity. This is our mechanism of action. The therapist does task-specific practice while stimulating the vagus nerve, increases the neuromodulators in the brain, which leads to a motor-rich learning environment. This allows the neurons around the affected area to create new connections and actually impact the overall function of the patient. What is MicroTransponder or where we are today? Our technology is really grounded in a Nature paper that was published in 2012 that described our mechanism of action, a Lancet publication that is our randomized, triple-blinded, sham-controlled crossover study that was published in the Lancet and then gave us FDA approval in 2021. We have 21 patents that describe this paired VNS that gives us 2 to 3 times X over rigorous rehab today. This led to a $73 million commercial phase round that we closed last year, led by USVP. OUP and Action Potential were in the syndicate. Now let's talk about commercial. We have a CPT code that exists today, 64568, which is a cranial nerve modulation. This market is a $54 billion market just in the United States. That's 200,000 patients on an annual basis that fit within our indications of use, and 2 million patients that are already existing that have this problem that are out there, partly because our clinical data showed that whether you are 6 months or 10 years post-stroke, you still have a 2 to 3 times benefit. That has surprised every neurologist and every neurosurgeon out there. We've actually proven neuroplasticity. We have 3 randomized clinical studies, 2 of which in the pilot phase. We recently have completed publication of the 2 and 3 year data, which shows sustained benefit as well as improvement over time. In terms of our launch, like many medical device companies, we started going to our clinical trial sites and then quickly moved to commercial centers where we are very focused on trying to understand that referral pattern to get to as many patients as possible, but in a way that is a true program. Over time, there'll be targeted expansion as well as scaling that business. What I want to finish with is really something that's super important, that is a foundation and one of the values of our company, which is a patient story. Our second patient that we implanted was from Chicago, 70-year-old lady, 5 years post-stroke, and one of her key ADLs was she wanted to be able to write letters to her grandchildren. And on the last day, she handed our clinical specialist a note written with her affected arm. This is why we're in the business. I would like to just say thank you to LSI for this opportunity, and we're super excited about how many patients we're going to be able to treat in the near future. Thank you.